If you struggle with sleeping through the night and find yourself consistently waking around the same time in the middle of the night, nearly every night, and not being able to get back to sleep, you may want to listen to this episode. More than likely, it could have something to do with your hormone levels, no matter what stage of life you're in right now. Today, I sit down and talk with Dr. Valerie Bonnett, who specializes in just this, in working with women, mostly middle age and beyond, to regulate hormones, to figure out what's going on, what imbalances may be present within their body. It may not just be hormonal, but she specializes in working with women's health, and I think you'll really enjoy the conversation we have. Thanks for being here today, and remember to head over to our Facebook community, Cultivating Health, Harmony, and Happiness, and join in the conversations we've got going over there in regards to how this could be impacting those elements in your life. Welcome to Health, Harmony, and Happiness with Kathy. I'm your host, Kathy Stricker. I'm a wife to a law enforcement officer and mama to 3 lively littles. I'm a business owner, yoga teacher, health coach, and wellness and life enthusiast. And what I really like doing is connecting others like you with resources that could bring you health, harmony, and happiness on your life journey. These 3 elements are a result of that inner light that flows naturally through you and brings contentment. They happen when you seek to live mindfully as your best self and tune in to following this inner guidance. May this podcast serve as a nudge to discover tools that could help you on your path towards more conscious living. I'm talking to Valerie Bonnett today about hormones, and we're going to dive into that and a little bit more about what she does. She's in the Marion County, Iowa area, so she is in Pella, but serves people all over the county and the area, I suppose.
Yes.
And it mainly focuses on women's health, right?
So I am actually a medical doctor. I have a traditional medical background. And in fact, I went to the University of Iowa and I did medical school there. And then went into family practice because I thought that would be the best way to get a well-rounded background so that I could take care of everybody pretty much. And what happened is when I did family practice, I realized that all the really good residency programs were in the Midwest because we didn't have to fight. There was a better respect for family medicine, versus if you're going to go to areas where it's all specialized, and a lot of really good training programs in family medicine. So I ended up going to the Quad Cities for my residency training. And my first rotation in residency was obstetrics. And I fell in love with delivering babies. It was just, it's just such a miracle, and it's so exciting and fun, being able to see that miracle when that baby comes out and takes its first breath.
Absolutely. It's very spiritual. And I mean, if you're even not a religious person, that is such a spiritual thing because, oh my gosh, you're changing the world just by doing that because you brought another life into this earth.
Exactly. It's such a miracle, everything that has to happen, for a baby to develop. And, it was just so fun and so exciting. And I just instantaneously fell in love with doing obstetrics. And so as I was going through residency, I took a lot of electives doing obstetrics. I delivered a lot of if anybody got pregnant in our program or their wives got pregnant, I ended up doing a lot of the deliveries for the people who were my peers.
Yeah.
And just had a great, fantastic experience doing obstetrics. Well, of course, if you do a lot of obstetrics, you're doing a lot of women's health care.
Right.
And so I kind kind of specialized in women's healthcare just from the fact that I was doing a lot of obstetrics.
Sure, and that was a natural flow, basically.
Exactly. As another part of my training, I did a lot of stuff with international medicine. I went to a really small hospital in Africa and Kenya and got to do a lot of obstetrics there. And so just those two kind of things, international medicine and OB, were kind of the things that were really exciting and fun
Sure.
and for me. And so when I got out of residency, I wanted to continue doing that sort of work. So I ended up working in some clinics where I really kind of specialized in continuing obstetrics and well woman care. So anyway, that's kind of how I got into doing a lot of women's health is that just that's who you're taking care of. If you're doing OB, you're taking care of women.
Absolutely.
If you're taking care of women, you learn about women's health so you can do a good job.
Yeah. So what does that mean you do now?
I did OB for, I don't know, 20 something years. And I became a parent. I adopted my daughter from Africa. And then I discovered that, it's hard to be a doctor and be on call. And it's very, very hard to be a single parent, but it's almost impossible to do both at the same time.
Oh, I bet. Oh my gosh.
So all the things that I tell people to work on, like, sleep enough and work on stress reduction and keep your cortisol levels low, I was doing none of the things that I tell people to do.
Yep.
And so at this point in time,
How old was your daughter? How old was your daughter when you adopted her?
Well, she was 3 when she got to the U.S., when I was able to bring her to the U.S. She was about 3 months old when I started the process of adopting her. And, that's one of the things that, I think it needs to be easier, that we should, not have to wait that long to adopt kids either in the U.S. or internationally. It should be an easier process because those kids, they really need to be in a stable environment before they're 3 years old.
Yeah. But you also want to make sure they're going to a good home, and all of that, there's some scary stuff out there. But that is a whole nother podcast. The light bulbs are going off, right? That's a whole nother
podcast. There we go.
Okay. So she was 3. So right? You definitely were at a place where that can be a tough age. And so sleeping is important. Sleeping is critical, but you had been through some years of probably quite a lot of stress because of the adoption process as well as your career.
Oh yeah, definitely. So, but that was easy compared to when she was finally here and you're trying to get childcare,
right.
And you have issues with babysitters that don't work out or people, so I mean, you're, bringing her to the hospital when she's 6 years old, at night because your babysitter didn't show up or whatever. So tons of stress and exactly the opposite of what I try to tell people to do now.
Right. So what is it you tell people to do now? You work a lot with hormones, and managing your hormones and how that plays into your life. Let's talk about that a little bit further. Unpack that for us.
So I think to unpack that, I should talk about how I got interested in this in the first place.
Absolutely.
And, when you're doing traditional medicine and let's say you have a woman that comes into your office and you're a traditional doctor, and let's say they have depression or anxiety. As a traditional doctor, what do we do with somebody who comes in with those complaints?
Give them medicine, medicate.
Exactly. We medicate them. If you have depression, we have a list of medications that we use for depression, right? Mm-hmm. And if somebody has insomnia, we have a list of medications that we use for insomnia. And if we have somebody who has anxiety, there's a list of medications that we use for anxiety. And so as a traditional medicine doctor, that's what I was taught to do. And that's the standard of care. So that's what you do.
Right.
And so I was seeing women in the office with these problems. And, you know, maybe I saw somebody with depression and would put them on an antidepressant. And I would see them back, you know, at maybe 2 or 3 months. And maybe they're doing okay at that point. Maybe the medication is helping them. You know, maybe they feel better. But a lot of times I'd see them, you know, later, maybe it's 6 months. And the medication wasn't working as well at that point. So then what do? You know, you either increase their dosage or you add a second medication because maybe they have fatigue or sexual dysfunction or something because of their first medicine. So you add a second medicine to get rid of those side effects.
Right.
And I'm starting to think, maybe this isn't really beneficial for this person. And maybe it's not even really scientific, you know, because what are we really doing, you know? And I don't
masking,
think that the
right?
science
Like,
we're masking.
Masking.
Exactly. We're not figuring out what the primary problem is, and we're not fixing the primary problem. And then I would see that woman who was, you know, let's say 60 years old, and she'd been on Prozac since the day it came out. And she wasn't getting off of that medication, and there wasn't anything that I was going to be able to do to fix that. And so I started like having a lot of doubt about what I was doing and whether it was going to be beneficial for people.
Yeah, and that intuition was speaking to you pretty clearly at that point. You were realizing,
right.
Wow, I feel like there's something more that I need to be doing. Is that right?
Yeah, exactly. Because I mean, I went into medicine to help people, and I didn't really think that what I was doing was being helpful or beneficial. And so at about the same point in time where I'm starting to be a little skeptical, I got introduced to the idea of functional medicine through a compounding pharmacist that we had in the Quad Cities. And he invited a bunch of providers from the area to a functional medicine conference. And I started hearing about things that were brand new to me, like, let's say, like vitamin D deficiency.
Mm-hmm.
And, you know, the association with like muscle pain, you know, plus the 3,000 different things that vitamin D does.
Right.
You know, and I came back from this conference and I saw a lady with fibromyalgia. I'm like, let's test your vitamin D level. And lo and behold, it was like extremely low. So I'm like, well, let's try some vitamin D and see what happens. And her pain got better.
Oh my.
So yeah. And that was like so cool to see actually somebody improve with something that was safe and had, you know, basically no side effects. And it was just really exciting.
Or really good side effects.
Exactly.
You know? Like,
exactly.
That's the thing.
Like, right.
You're going to just feel better. You're going to have more energy. Like, those are the good things that they don't put in commercials, right? Like, beware, you could feel better. You could have more energy. You could sleep better. You could, I don't know.
Where vitamin D needs better marketing,
It
right?
does.
We need to have a $10 billion, you know,
it does.
For marketing, right? Instead of like antidepressants and all this other stuff.
Oh my. Side note detour, just real quick. What do you define as functional medicine?
So, you know, for me, I defined functional medicine as being a kind of a scientific, and I'm just making this up, okay?
That's fine.
So kind of a scientific way to approach the human body and looking at giving our cells what it needs, what they need for our entire body to function at an optimal level.
Okay.
So I think functional medicine is a scientific way of looking at what do our cells need for optimal function.
Okay. Awesome. And we all want that. You don't want
Yeah.
to take something so then something else hurts or something else is a
Right.
bother. No, you want to do something so that your whole being feels much better.
Exactly. Exactly. I mean, we have a lot of deficiency states because, that we're dealing with as a society because, like let's say sleep. We have a sleep deficiency in America.
Absolutely.
And that
I'm
sleep
experiencing
deficiency,
it right now,
yeah.
but I
You know
also
what?
have a newborn.
Yes, exactly. So you know exactly what I'm talking about. But, a lot of this, some people have a sleep deficiency and they can't help it. You can't help your sleep deficiency. But we have, a whole generation of people who are like, looking at YouTube videos at midnight instead of
Right.
sleeping.
Right.
Or Snapchatting their, teenagers who are Snapchatting their friends instead of sleeping.
Right.
And, keeping up with social media instead of sleeping. And sleep is a primary human need, and if we're not sleeping, then everything else starts breaking down.
Yeah.
You know,
Absolutely. I've I mean hands down remembered that with this season of my life when it comes to nursing and milk production, that if
oh
I'm not
yeah,
sleeping and I'm not getting enough sleep, my body does not want to produce milk. It doesn't want to do anything. It wants to do the basic necessary things to stay alive. And folks, milk production is not one of those for me. For my baby, maybe, but my body doesn't recognize that and realize that. So, I mean, sleep is crucial.
exactly. It's crucial. Sleep affects everything from whether we're going to get diabetes, whether we're going to gain weight, whether our immune system is going to kill off viruses, bacteria, fungus, or cancer cells, whether
Yeah.
we're going to make neurotransmitters, whether we're going to have chronic pain. I've never seen anybody with fibromyalgia who slept well.
Right.
I think there's a big relationship between not sleeping and having, chronic pain. And so sleep is a primary human need. And, it's easy for me to say you need to sleep, but some people are they can't sleep because maybe their hormones are screwed up, and some hormonal deficiencies will cause insomnia, and some hormonal excesses will cause insomnia. So
And that's
insomnia,
crazy that
it is
sleep can do both directions of that.
exactly. Sleep can be caused by hormonal imbalance, and insomnia can make that hormonal imbalance even worse. So
Gotcha.
ev- everything is connected.
Yeah. Yeah.
So
Okay, let's go back into that then, with the functional medicine and how everything's working together and how your hormones come into place with this. Speak to that a little bit more.
yeah. So anyway, at this class, when I was introduced to the idea of functional medicine, they talked about how hormones affect our health. And for women, we always think of estrogen as being the important hormone for women, and it certainly is. It has, depending on what expert you read, it has between 400 and 800 functions in our body.
Wow.
Estrogen, yeah, estrogen is a vasodilator, meaning it opens up our arteries. So if we have open arteries, we have better blood flow to every tissue in our body. If we have better blood flow, things are going to work better.
Right.
So you can say that estrogen affects every area of our body by improving blood flow. Estrogen also, it helps with temperature regulation. So the loss of estrogen, can cause women to develop hot flashes and night sweats.
Yeah.
And we've already talked about sleep. If somebody's having a temperature instability and they're getting really super hot, and then they're getting cold, and they're taking the covers off, and maybe they have to get up because they're soaked, because they're sweating so much. that's impairing their sleep and causing all of those other problems we've already
Sure.
talked about,
It's a spiral effect.
Exactly.
It just
Exactly.
keeps going.
Yeah. So estrogen is super important, but too much is a bad thing too.
Yeah.
So too much estrogen can stimulate the growth of uterine cells and breast cells and can increase cancer risk. All right.
So how do you know if you're
So
in
so
balance or not? And how do you
so
find
you
that balance then? And what it has to be balanced with progesterone, right?
exactly. So progesterone helps decrease the growth of breast and uterine cells. So and progesterone helps decrease anxiety and it helps improve our sleep. So progesterone is super important um, to help make estrogen safer. Um, Progesterone helps increase estrogen receptors, so it helps estrogen work better, and it has its own effects on mood and sleep and also bone density and, other
Sure.
things, So, yeah, the bottom line is estrogen is super important, progesterone is super important, and they need to be balanced with each other.
Yeah.
Women also need testosterone. We need a little bit of testosterone. Men need a little bit of estrogen. Um, Testosterone in women helps bone density. It helps with muscle support. It helps with memory and mood and energy. Um, so we need a little bit of testosterone, but we don't need very much. And once again, testosterone has to be balanced with estrogen or progesterone, or women will have acne or increased facial hair, or even an increased risk of diabetes. So, once again, everything is important. Everything needs to be in an ideal range, and everything needs to be balanced with each other.
Yeah, but we walk around this world no clue if they're balanced or not, and no clue if those are the things that are causing us to be tired, to be grouchy, to be whatever it may be on a particular day. So, how do you go about working with someone to balance those hormones and to find out what levels you're at? Because I'm sure, everything is cyclical. So, they go up and down
Exactly.
throughout the month, throughout the year, throughout the seasons of
Yep.
your life.
Yep.
What do you do?
Well, I think that that's really important to realize that people at different stages of their lives also have different abilities to self-correct their hormonal imbalance. So, maybe if you're 25 years old and you have, PMS or something, um, maybe stress reduction and eating less carbs and having more nutrition and sleeping better, you might be able to get your hormones back in balance with just having healthier habits, right?
Yeah.
Well, I think at 45, when women start like losing the ability to ovulate, we start losing the ability to make enough progesterone to balance the amount of estrogen and potentially testosterone that we have. And so I used to see a lot of women in the office, and maybe in their mid 40s, they would stop sleeping through the night. They start waking up at 2 or 3 in the morning. They think they had to go to the bathroom, but you fix their hormone thing and they didn't have to go to the bathroom at all. They just were awake. So they
Sure.
got up,
Sure. Because they
you
thought,
know,
oh, do I have to go to the bathroom? Well, yeah, sure, I'll go.
yeah, that must be why I woke
Yeah.
up. But it wasn't. They woke up because they weren't making very much progesterone anymore.
Okay.
And I would test, and I'll talk about how we test, but I test them and they had lots of estrogen, but they just didn't have any progesterone. And so I'd put them on progesterone, and guess what? They would sleep. Plus, they'd have less
Yeah.
anxiety, you know?
Yeah.
So, yeah. So you correct, the hormonal imbalance based on where they are in life, and whether they have the capability of making these hormones on their own or not.
Sure.
You know,
Sure.
and at 50, women, a lot of times they will start, maybe having a decrease in estrogen levels. Not everybody. Some women are 60 years old and they still have enough estrogen.
Okay.
But a lot of women, their estrogen levels will start dropping and they'll become symptomatic because estrogen is
So
low.
what are some more of those symptoms when your estrogen starts to decrease? Like, what are some key indicators that someone should say, oh, you know what? Maybe I need to get my hormones checked because this has been going on for da 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 da.
So the common things we think about are, obviously going to be, hot flashes and night sweats. Brain fog is common with loss of estrogen. Memory issues, vaginal dryness, pain with intercourse. I think like going to the bathroom more frequently, like urinating because your bladder doesn't stretch out as well. Maybe thin skin, rapid aging, aches and pains. I think your joints become less healthy, so maybe more joint pain and things like that from loss of estrogen.
Okay.
Because it affects collagen,
Sure.
more wrinkling, those fine wrinkles. So things like that from loss of estrogen. But the weird thing is, some women will have high estrogen, but they still have all of these symptoms because they don't have very many estrogen receptors.
Oh my gosh.
And so imagine what happens if you don't test and you just put somebody on estrogen based on their symptoms. You could be potentially overdosing them with estrogen.
Sure. That makes sense. There's so many components that go into this.
There are. So things with progesterone deficiency, a lot of times that's going to be associated with mood issues. So anxiety, irritability, moodiness, nervousness, maybe panic attacks, getting angry easily. So feeling cold, it can cause depression. And I think sleep disturbances is probably one of the more common things I see with progesterone deficiency. Like I said, women in their 40s, they're not ovulating regularly, or they don't make a lot of progesterone if they ovulate, and they'll start having, these symptoms.
Yeah. Just because I'm so curious, and obviously I'm still like postpartum stuff, but when does that become, when can you test when you're in this stage of life? Like with me, or are hormones just so crazy after you have a baby that you have to wait a certain amount of time before you check them? What does that look like for someone who is postpartum?
Well, it's funny because, imagine postpartum is a time period where people tend to have low progesterone levels anyway, right?
Yeah.
Because during pregnancy, you had this baby on board, and this baby had a placenta, and that placenta was, creating tons of progesterone. So you are awash in progesterone, and, most women are going to feel, even though they're not comfortable, they're not sleeping that great because they're uncomfortable, still their mood is pretty good. They're pretty, a lot of times they don't have a lot of anxiety because they have all of this progesterone on board. And then the baby comes out and the placenta comes out and your progesterone levels plummet because it's just, you don't have
sense.
that production anymore,
Right.
So postpartum time period, not only do you have more stress because you have a brand new human being who's depending on you for 100% of their care, right? So your stress level is higher. You have sleep deprivation because this baby is waking you up at all hours of, the day and night to nurse,
Yeah.
So there's sleep deprivation and there's progesterone deficiency, so it can be, it can contribute to postpartum depression in women.
Sure. I mean, you're listing these symptoms, these, like mood issues, and these are all the things that as a new mom that you're warned about and you're told, be just be aware that these are things that could happen. Your anger, anxiety, restlessness, nervousness, all of those things could be symptoms of postpartum anxiety or postpartum depression.
Yeah, absolutely.
So, it's kind of comforting or a good message to be able to pass on, also not only to myself, but to my other friends who've recently had babies who are experiencing a lot of these same things too. And that, there could be something more there than what doctors would typically prescribe or medicine for.
How is prescribing something going to help with your sleep deprivation? How is it going to help with your hormones?
Right.
It doesn't really make sense scientifically.
Right. All right. So let's get back on with hormones and balancing them. So what does that look like? How do we go about finding out if we are in balance or out of balance, and then how to treat it?
Well, so what I recommend is I think you have to look at accurately what's going on at a tissue level. Okay. We have to, there's a big difference between if we want to do a blood test for our hormones and if we want to do a tissue level test for our hormones. Okay. And a tissue level test is going to be either a capillary blood test or a saliva test. And so I have utilized saliva testing with my clients for probably at least 15 years. I'd have to look back, but I've been recommending saliva testing with my clients for probably about 15 years. And the benefits are it's extremely precise. All right. If you're going to order a blood test for, like, let's say estrogen, the levels can range from, the range is huge.
Sure.
Because hormones aren't active in your bloodstream. Most of them are the bloodstream is used for storage for our hormones. And a lot of our hormones are bound to proteins, so they're not active. Okay. So they have to get into the tissue where they work.
Gotcha.
And so you should test the tissue to see what the levels really are at that level. And once you start using, like I recommend using topical hormones, okay? Because you can get nice levels. It's controllable. You can change how much hormone you're getting. If you get a pellet implanted, that's going to be there for 3 months and you can't change your dosage.
Right.
All right. If you're taking capsules or pills of hormones, most of those are going to go through the liver and get, removed before they even get into your bloodstream. And with the use of estrogen, taking estrogen by mouth is going to increase your risk of having strokes or heart attacks because they make your platelets stickier and they increase clotting factors. So I recommend using topical hormones.
And how do you measure those out, or how do you know how much you're using of them? Like, if you just, is it in a lotion form or something like that when you say topical?
Yeah, it's good. Yeah, it's either going to be in an oil or a cream.
Okay.
And, you're going to have like a pre-measured dosage
okay.
of that. Okay. So you know exactly how much is in the dosage, or let's say you use 1 pump or you use 3 sprays, depending on what
Gotcha.
you're using. Then you change based on the amount of the hormone that you're getting.
It's very much an awareness thing, a body awareness thing too, because you have to start to realize if you've been taking or using that hormone and you start to feel differently, then there may be an adjustment that needs to happen.
Absolutely. And there's also that importance of retesting to make sure that you're getting, exactly what you need and that you're not overdosing.
Right.
Because the last thing on earth you want to do is use more estrogen than what you need.
Right. So how often do you recommend retesting?
Well, ideally, whenever you make an intervention, you're going to want to retest, let's say 3 or 4 months later, and then at that point you get into you've gotten into a good zone and, you don't have to test that often, maybe once a year. But, I find that a lot of times, even using low dose hormones, you have to reduce what you're using instead of like increasing. So I find that a lot of times, even a low dose is more than what people really need. And when people get into balance, they feel really good. I have some people that have been on, very low dose hormones, and I've actually reduced their levels, and they come in and I'm like, well, what are your symptoms right now? And they're like, well, I don't have any symptoms. And I'm like, these people are like in their late 50s or early 60s. I'm like, you don't have any symptoms? I'm like, oh my gosh, are you kidding? And I'll show them the list, and they're like, no, I feel good. I'm like, nobody
That's
feels
fantastic.
good. Everybody,
Yeah,
I
that's
know.
fantastic.
I know. And it's crazy. It's crazy because, as a society, everybody's got something going on.
Right.
So these people are using very, very low dose hormones. Their levels are, in good range, and, they're sleeping and they feel good. So
it
I mean, how
works.
cool is that?
Yeah,
Yeah,
it
it
works.
does.
Balancing hormones can be a tricky thing, I think. But you seem to have a good system in place for helping someone go about doing that, right? And
I've
figuring
worked
out
on
what
this
works for them.
right. And I've done this for like a long time. And what I have done is like I learned from, I don't want to say my mistakes, but what other people have recommended, I've like recommended for my clients. And like, let's say oral progesterone. Oral progesterone, a lot of people recommend it because it does break it down into your liver into something that is very sedating. And so people recommended at bedtime for sleep. So I started using it with people, and I would find that they were still waking up at 3 o'clock in the morning.
So it's not really solving the problem.
Exactly. And then I would do a saliva test in the morning, and they had no progesterone. And I would be like, you used 200 milligrams of progesterone and it's not showing up in the morning. Did you take it? And they're like, we're not stupid. You told us to take it. Of course we took it.
Right.
And it was being eliminated before morning. And so I think to myself, okay, this person has estrogen on board all day long because they're using it topically, and they have no progesterone. That can't
There's something
be
wrong
good
there.
for your...
Exactly.
That's probably not great for your breast or your uterus, And so I stopped using oral progesterone, even though I still hear people who are recommending it because of the sedating power that it has. I don't use it anymore because you're not getting that coverage,
Yeah.
So, and my dosages have gone down over time because at higher dosages, their levels are too high. And the weird thing is, if you have too much estrogen, you will develop estrogen deficiency symptoms because your body, those cells are going to decrease your estrogen receptors, because I think what's happening is your body doesn't want you to get cancer. So it's going to reduce your receptors
and try to protect
all that estrogen, try to protect you from the extra estrogen that you have coming in.
Yeah.
So I see other people on these weird Facebook groups that are using, they're starting women on dosages of estrogen that are 24 times the amount of estrogen that a young, healthy woman makes.
Oh, boy.
Okay. And then they're doing a blood test, and that hormone does not show up well in blood if you're using it topically. So their blood levels don't go up. So they increase that estrogen. And some women are using 100 times the amount of estrogen that a young, healthy woman makes.
Wow.
I mean, that's
yeah,
crazy.
That's really crazy. There's no need.
No, we don't.
And you can imagine how that's making that woman feel. Like just
exactly
out of whack.
Exactly. And I can't imagine what that's going to do to, to breast cancer risk and uterine, fibroids and uterine cancer risk. And, and they don't feel good.
Right.
So it's like, okay, let's look at what is physiologic and let's use that amount of hormone. Let's make sure everything's in balance with each other. And I address testosterone, I address DHEA, and I address cortisol because, believe me, if your cortisol levels, off the chart, your other hormones can be in balance, but you're not going to feel good.
Right.
You're not going to sleep if your cortisol levels,
right.
3 times normal at bedtime. You're not going to sleep, and you're going to have problems with that.
Right. Okay, Val. So how does this bring health, harmony, and happiness into your life? All of this work that you're doing, or even how you have experienced it yourself from doing this work on yourself and with clients?
Well, I think for me, I'm still in the process of doing the things that I tell other people to do all the time. Work
Sure.
on stress reduction, make sure that you're sleeping enough, and make sure your hormones are really in balance. And I use the hormones that I tell my clients to use. I use the same things. I don't have any more hot flashes or night sweats. If I keep my stress level down and I get the right amount of activity and I eat well, then I sleep well at night.
Absolutely.
And everything works better.
Yeah.
So, I'm working on trying to do the same things
Good.
that I tell people to do. Yeah.
Good. But it's a part of everybody's journey, and it's a part of our life, and we all go through those seasons where, oh man, this is harder right now than it has been, but I will get through it and we'll get on. So that's good. Yeah.
Yep.
Okay. So how can people get a hold of you? What's your contact info, or how can they reach out? And I will link to all of this in the show notes page as well.
So first of all, let me just say I hate talking on the phone, so please don't call me. Go to my Facebook page. It's Dr. Valerie Bonnett, MD. I have a bunch of videos on there. I'm trying to convert from doing one-on-one visits with people into doing group visits and, more of an educational platform, because believe me, there are like 40 million American women between the ages of 40 and 60, something like that. There's like 6,000 women who go through menopause every day.
Yeah.
The vast majority of those women are getting very, very, very bad, dangerous advice. And I can't work with everybody individually.
Right.
So what I want to do is like this, getting this out to more people. So if they can either work in a group setting, or if they go to somebody who's supposed to understand hormones, they know what to ask for.
Absolutely.
And they know what levels, what dosages are going to be safe. And they can go to their doctor and say, hey, I want this, but I'm not going to use this because it's not safe.
Absolutely.
So I'm trying to change so that I can help educate women that they don't end up on a program where they're using 100 times the amount of estrogen that a young, healthy woman makes.
Right. And that is fantastic. Thank you so much for taking your time today, Val, and for enlightening us. And she is a wealth of information, people. So take advantage. Reach out, get involved on her Facebook group or on her Facebook page, and see what happens. Connect with her, because she's got some good info, and it's exciting. And it sounds like various stages of life as well. And you've seen it all for women, from birthing babies into moving into that menopause and postmenopausal stage. So a great resource that we have available.
Thanks, Kathy, for letting me speak with you today and your audience. And you have a blessed day. And thank you very much.
Wonderful. You're welcome. Thank you, Val. Friends, Valerie has so much information to share, and what we talked about today probably wasn't even the tip of the iceberg. She really is a great resource. If you are experiencing any of the things that we talked about today, whether it's sleep disturbances or drowsiness, brain fog, whatever it may be, it may not be that it's just in your mind, or that you're not getting enough sleep, or that it's something that's out of your control. even if you are going through that menopausal phase right now, this is something that can be looked at, can be tested, because these hormones are still naturally present and needed in your body. So do some further research. Allow yourself to feel the best that you possibly can. And if you don't feel the best that you possibly can, then perhaps it's worth evaluating what's not working in your life or what is working in your life, and then doing research towards that. In any case, Valerie is available and out there on Facebook. You can find her at Dr. Valerie Bonnett, MD on Facebook. Reach out to her. Get involved with some of her groups, with some of her conversations that are going on her Facebook page, or maybe even some of the workshops that she has out there and available. I have also linked to Val's contact information on the show notes page at cairnyogawellness.com/podcast27. And I've also listed out some of those symptoms or red flags that may indicate that your hormones may be out of balance on that show notes page too. So if you forgot and you want to go back and look at them, head on over to cairnyogawellness.com/podcast27 to get those show notes. And finally, just a little nudge to remind you to head on over to Apple Podcasts and leave a rating or review for this podcast. That's how this show gets seen by more people and is put out there for the world so that we can grow it. I would be super appreciative if you would take just a moment of your time and leave a rating or a review. And then also share this episode or share one of the other episodes with someone who you know that may benefit from it. Thanks for tuning in today, friends. Cheers to cultivating more health, harmony, and happiness in your life. I hope you enjoyed today's episode. Thanks for tuning in. If you like what you hear, help us grow this podcast by sharing it with even just one other person. And it would mean so much to me if you would take a moment of your time to write a review. Your comments and feedback are what help me continue to bring you topics and guests that can help you and others on their journey in creating health, harmony, and happiness. Remember to head on over to cairnyogawellness.com to get the show notes and links from today's episode. Follow me on Facebook and Instagram at Cairn Yoga Wellness, and to continue connecting with more resources that could help you enhance health, harmony, and happiness in your own life, subscribe to this podcast. Thanks again for listening.